Could you move on to the next slide, Fad? Perhaps this is, in my opinion, the most important slide in my presentation because it essentially explains what Zika Healthcare does. Over the last 15 years of experience in bringing new and innovative rapid self-testing products to the marketplace, this is essentially everything from pregnancy tests right the way through to vitamin tests. So if you have any sort of latent demand in there, we can create it, design it, and do all of the regulatory work in regards to this. And we have our own brand of blood pressure monitors, oximeters, digital thermometers, and infrared thermometers. And we're constantly working in brand new products. We're about to launch one or two products that I would like to tell you all about, but once we bring them out, I hope to be able to share them with Invest NI's office in the Middle East. As you can see on the slide, we currently sell into over 70 countries across the world. That essentially stretches from Uruguay to all over North America, to the Caribbean, Europe, Africa, the Middle East, Far East, and Australia. So over those last 15 years, we have grown deeply into each one of those countries. Some of our partners include Walgreens, Walmart, Shoppers Drug Mart, Asda, Morrison, Sainsbury's, all of the leading pharmacy chains across Europe or across Britain and across America. So can we move to the next slide, please? So obviously, we all know we're living in a COVID-19 situation here. So with our team and the partnerships that we formed, namely the RTC UK government antibody test, we have created 2 or 3 different types of tests. As you can see, test 1 is an antigen rapid test, which is a saliva-based one. Test 2 is an antibody rapid test, which is blood. The third one is an ABC, obviously antibody test, which is also blood, and the COVID-19 Smart app. I'll tell you a little bit more about the UK RTC consortium. The British government created a consortium which brought 4 component parts in to create the first UK made and manufactured COVID-19 test. So recently we received some very big orders, and what we're in the process of doing is taking this to as many countries across the world. It's the first one of its type, and it has worked very, very well. So moving on to the next page, Fad. So as you can see, there is all the specificities and accuracies. I think that's fairly straightforward for everybody who's in this field. So we can move on to the next page, Fad. So as you can see, this is one of our own personal COVID-19 tests. This was one of the tests at the start of the COVID-19 test, or COVID crisis, that we supplied to the British government and numerous other countries across Latin America and across the Caribbean. We found a great deal of success with this test, and it's also helped us gain footholds in new marketplaces, places like Guatemala, Panama, Honduras, and places like that. So if we move on to the next page, please. So once again, as I said, this is the new 2019 COVE antibody test. As you can see, I won't bore you with going through all the details because I'll be happily speak to everybody about it. So as you can see, it's a very detailed test, and it's passed all of the regulatory requirements that it needs to be able to sold to either the governments or private companies across the world. Next page, Fad. And once again, this is another example of the COVID-19 antibody test. This particularly was one we have had much success in selling to companies across the UK. where essentially they wanted, essentially in the building industry, where they wanted to test everybody. So we really gained a large traction with this product. Moving on to the next page, Fad. Yes, this perhaps is the second most important page. The Oxford COVID-19 vaccine and the UK RRTC ABC-19 rapid self-test and test. These two products have been designed to work hand in glove with each other. As we know, the government has spent a vast amount of money with the Oxford test to get it out to as many people as possible. Now, our test works hand in glove with that. So what we have found is the government has purchased a monumental number of the Oxford tests to use our test as a backup as well, to see if there's antibody resistance has been created. So what we are especially skilled at doing is working with these types of companies that are very scientific, very medical based companies. And what we can do is we can actually help them to actually commercialize a product, because that in the end is the key reason why companies are in business, to commercialize products and put them across the world. Now, these products, as we speak, already feature in Australia. They've already been approved in America, and we're doing quite a lot of work in some parts of West Africa as well with this. And it's been proven to be very successful as well. And in many ways, it's a UK success story in this field. So next page, Fad. And once again, this is starting to talk about the link between doing tests and track and trace, where you can get the results over the mobile phone. So next page, Fad. And that's it. I apologize if I ran, I apologise if I ran somewhat over time, but the key thing is Sika Healthcare does what it says it does. If you've got a demand for a product, we can help you create it. We can help you with all the regulatory work. We can make sure it's got all the regulatory things that you need, stretching from BRC right through to ISO. We have all of those. And we have created many new and innovative products. So I'm looking forward to hearing any questions from you. And if you have any other questions, just contact Fad, or just contact us on our website as well, and we'll be only too willing to help you.
Great, thank you, Neil. And it seems like you guys have had a very busy time over the pandemic, trying to keep people safe, traveling or going into work, particularly with your COVID testing as well. So keep it up. Fantastic to see that. Now, moving on, I'd like to invite Mark Canning, who's a director at MPA Recruitment. Mark, if you'd like to switch on your camera and unmute yourself, please.